Thank you, Victoria, and thank you all so much for taking time out of your busy schedules to be here. And I want to, before I start this kind of quick introduction to the day, I want to do a little bit of a survey. So who here has been doing work with wearables and mobile technologies for more than 5 years? Okay. 3 to 5? 1 to 3? And who is just getting started? Awesome. Okay, so we have a spectrum across the board, and that is exactly what we want today. But first, I want to start with, who are we? Why are we even here? Okay, so where did MeTRIC come from? So this all started back in January of 2022. Srijan Sen, who is the director of the Eisenberg Family Depression Center, created research cores to further the missions of the center, including research innovation, data and design, and outreach and education, as well as our group, the Mobile Technologies Core. And our goal was really to increase capacity for interdisciplinary research that used mobile technologies with the ultimate goal of improving mental health. We wanted to really decrease that activation energy with getting started with your research with mobile technologies. And the most important goal we had was not to duplicate anything. So in fall of 2022, we began offering services. See if I can pull this up so I can see it here and not turn around from you guys. Nope. Okay. We began offering services. We formed our Mobile Data Experts Network, which is a group of data analysts, essentially anyone who processes the data, touches the data. And we moved DigitMI, which is a general interest group for mobile technologies health research, under our umbrella. January 2023, we formed our Mobile Coordinators Network Affinity Group, because if you are a research coordinator and you deal with mobile technologies, there's obviously specific concerns that you have related to that. And in July of 2023, we formed MeTRIC. Okay, so why did we form MeTRIC apart from having another thing at University of Michigan that has a cool acronym? So what we found is that we were really, in helping our investigators incorporate mobile technologies into their research, we were touching groups from across campus. And so we really wanted to leverage that expertise and those resources and include everybody in this collaborative. So that is why MeTRIC formed, to really formally coalesce these groups. It was founded by myself, Srijan Sen, Brahmaji Nalmathu, and Sachin Ketterpal. Keep in mind, MeTRIC, we don't have any organizational standing or dedicated resources. We're just operating through the privileges of all these different groups that are involved. So why incorporate mobile technologies in your research? I don't have to tell anybody here. This allows us to assess multiple parameters simultaneously, both objective and self-report. This allows our data collection to be passive in the subject's free living environment in real time, and it allows us to record data longitudinally. The population we can reach with mobile technologies research is at huge scale and far-reaching, and we can incorporate diversity. And ultimately, this leads to low participant burden in research, data recording over extended periods of time. So we've now moved from days to weeks to months to even longer, deep digital phenotyping, multiple disease states and contexts being assessed at the same time, whereas before things were siloed into different content areas, and the ability to develop novel interventions and deploys these through the devices themselves. However, conducting mobile technologies research at the University of Michigan can be difficult. We found that there was a lack of resources, an absence of coordinated institutional support, and really minimal standardization and infrastructure. And our goal has been to reduce these problems. So what have we done since January 22 to mitigate these challenges? So as far as resources go, we have developed a resource library, and at the end of the day today, we'll show you how to access all of this information, and it's also on the QR codes on your table tents and on your badge. So our resource library has a knowledge base of articles, a code repository, a video library, and even a questions and answers board. We provide research services, including consultations, so we can sit with you directly. We have a database of investigators that use different technologies technologies. So if you are struggling with a technology that you've now purchased 50 of for your study, we can hook you up with somebody that has likely had the same concerns and surmounted those. We've also developed templated PubMed searches, and we retain a list of open source mobile health data sets. Our knowledge base now has over 70 articles. They include topics like U of M resources, how to get started with mobile technologies, utilizing secondary data sets and best practices. Here's an example of how one of the articles looks. This is an article regarding how and why to share code in biomedical research. We love collaborating with different groups on these articles. So if you have any ideas to inform the U of M mobile technologies community, please let us know. This is our code repository, which contains obviously code that's related to processing data from mobile technologies. It contains code that's developed within our core, code that's shared by other people throughout University of Michigan within this space, and we also keep external repositories of open source code. So this allows you to share your code that you use for your mobile technologies research without maintaining your own repository. We also have a DOI number, so it can be tracked. The uses of that can be tracked, which is beneficial to you, copyright license, and this also meets NIH requirements. Here's an example of one of the automations that we've developed. Thank you to Gabriel Mange-Franco, who is our data architect. So this is code to clean sleep data from a Fitbit device when you are also using self-report sleep diaries. So this harmonizes that data and allows us to calculate aggregate sleep parameters like total sleep time, sleep efficiency, with more accuracy, but also without losing that benefit of mobile technologies, which is getting these values automatically. Our video library has at least 26 videos now with over 2,400 views. A lot of these views were Sarah Sperry's Ecological Momentary Assessment video, which has been a big hit. Thank you, Sarah. And this is a great place to go if you've missed one of our lectures and has a lot of wonderful content in diverse areas related to mobile technology. Here's our question and answers panel. If you've had a question about using mobile technologies in your research, it's highly likely someone else has, and this board is searchable. During our consultations, we touch a variety of topics, oftentimes device and technology selection, but also aligning what elements of mobile data that you can get with your research hypotheses and goal, different methodological approaches. We help you with your data flow and data pipelines. We can give you sample protocols, consents, and other study documentations. And again, automations for data processing, information on data cleaning, regulatory and compliance information, and oftentimes we're referring you to our other experts at U of M because that's how we make this work. We talked about that database of University of Michigan researchers. So these are all the experts we have. These are all the devices that have been used and the content areas, so we can always connect you with a collaborator. Something new that we've developed just recently are templated PubMed key searches. This is in collaboration with the library. And so if you're not exactly sure if you're scraping the literature for everything that's relevant, please feel free to use one of these searches. And we've provided instructions with combining these searches so you can combine, for example, a type of device with a content area. So here we show an example of, I'm looking for studies that use smart rings for sleep, and this is already populated for you by a librarian. Okay, how did we address the issues with having coordinated institutional support? In a few different ways. By building the mobile technologies community, we have a project on clinical trial management systems, and we are enabling texting in research. So mobile technologies community here, all the members of MeTRIC, so we have a wide reach, and here is also our structure of affinity groups. So DigitMI, again, that's that general mobile technologies health research interest group. We meet once a month is correct, and we have amazing presentations from investigators at University of Michigan. It's also a lively conversation. There's a lot of back and forth. Our MDen group is of data analysts, anyone that touches data, so they bounce ideas off each other. This is a great place for troubleshooting. And then our mobile study coordinator network, where you can really, really work with the people who are actually deploying these studies in the field. And at the end of the day, we'll show you how to register for any of these 3 affinity groups. By having the mobile technologies community, it's more than connection and collaboration. This also allows us to have just-in-time updates from our partners. So example, RedCap, we're now offering MyCap. That was something new we learned about. D3C has just put forth an introduction to just-in-time adaptive interventions online model. So we're a great resource for seeing what's new. Okay, our clinical trial management platform. So what we found along the way, so obviously when you're doing research with a wearable device, that's not the end, right? You need a software platform to ingest your data, to manage study tasks, to allow you to monitor participants, and ultimately, which is going to be the conduit to get your data out for analysis. And we found that people were just using a vast number of different products, and it was completely random. It was really an uninformed selection, so we wanted to help with that. And so with the leadership of Rima Kadri and Victoria Bennett, thank you both, they evaluated over 20 study management platforms, their features, their capacities, and the goal is we're going to settle on a few of these. We are going to get IA approval for these, facilitate a master service agreement, and then we're going to develop specific to these platforms data pipelines, code for cleaning the data as it comes from these platforms, compliance dashboard templates, and we're going to disseminate all this information. So we hope that can be a service to you that's beneficial to everybody's research. I'm going to skip this for the time being because of our technical snafu earlier. Other things that we were doing to support the institution in this type of research, we realized people were having a lot of issues with texting in their research, so we presented this idea to the HITS Ideas portal, and they're now in the final stages of investigating options to make texting easier and more effective in your research at University of Michigan. So one of the biggest things that we found as we've been going through the process is a lot of the gaps that we have can be found in the flow of data from the mobile device to the platform and then getting it into the University of Michigan environment for cleaning and analysis. That is where we found a lot of issues, and unfortunately, these issues are oftentimes only found after you've completed recruiting for your study. So our goal to address this is a common data model for mobile tech data as well as a data pipeline. So for our common data model, we obviously want to develop a standardized data model for working with data that comes from wearables and other mobile technologies. Once we have that common data model, we can then develop code and associated tools for cleaning and analysis. And our plan for this, our structure that we're going to follow, so first we're going to use content experts from across the university, as well as literature to determine clinically relevant measures from mobile devices. We're going to provide data dictionaries and database templates to reduce your setup time for doing these studies. We're going to create a directory of open source algorithms that use this common data model, transformation code, we'll share this, and we're actually going to publish our results. And this is a project that MDen is helping us conduct, and many of you who are content experts in your different areas, whether it's cardiology, endocrinology, we have already been harassing you, and so we thank you for your help. Now, to make a common data model, what do you obviously need? You need data. And so we have been able to obtain a variety of devices, and this is our wonderful data architect, Gabriel, and he has been piloting all of these. This is like, I think, 1, 2, 3, 4, 5, 6 devices on one body, and you can see him today and check out these devices hands-on at the EFDC table. Currently, the data pipeline situation, a lot of people are manually downloading their data once it's been collected and transforming it for analysis with traditional tools that are really not adapted to mobile technology data. So for this, we would like to purchase an enterprise-grade data pipeline tool. A tool to transform raw data into structured formats. We're going to need dedicated servers and a research integration analyst. But our goal with this is to make it so that this is an equitable, generalizable service at the university so people aren't stuck after collecting their data. And before we get started with our main program, we have had generous donations from all of these sponsors, and that is what has kept this conference free with no registration and allowed us to be fed during the course of the day. So we really appreciate that. And I hope you'll also share your experience today on social media at the Depression Center, #UMishMetric. And we have a lot of our sponsors have tables here today. And again, we have the EFDC device table, which you can check that out. Here is our land acknowledgement. And the team that makes it possible, not so much me, but Victoria Bennett, our core manager, Gabriel Mangi-Franco, who's our mobile data architect and deviceware, Daniel Todman, project manager, and Nicole Eyrich, who many of you have met with your work with Care Everywhere, who is a mobile health research specialist in anesthesiology. And then here's my contact information, which you guys all have. And again, thank you so much for your patience this morning and listening to me. And now we can get to the real science.